Come in.
Hello, Gary. My name's Magda, and I'll be one of your student nurses today. This session will take about 15 minutes.
Hello, Magda. I'm Gary, my wife's primary caregiver. I'm worried because the doctor indicated that TIA could be a precursor for cerebrovascular accident or stroke. Would you be able to tell me what the difference is between TIA and stroke?
Definitely. Before we begin, I'll just let you know that everything we discuss here is confidential. Also, are you sitting comfortably? I see that you're wearing glasses, but do you use any hearing aids?
Yes, I have a hearing aid in one ear.
Okay, no problem. Can you hear me well at this volume?
This is perfect. Thank you for asking, Magda.
Alright, so let's get started then. I can let you know about TIA, or transient ischemic attack. It is described as a mini stroke lasting a few minutes and causing no permanent damage. However, it is estimated that 1 in 3 people affected by TIA will eventually have a stroke or CVA within 1 year.
Okay, so what does that mean for my wife?
It means that the TIA is like getting a letter in the mail informing you that a stroke is on the way unless we treat it.
Oh, so how do you know she had a TIA if there was no permanent damage?
Some symptoms your wife exhibited were weakness and paralysis on one side of her body in the face, arm, and leg. She had slurred speech and wasn't understanding us or others talking to her. She had vision problems like blurred or double vision, a loss of balance and coordination, and a severe sudden onset headache.
Oh, so why did this happen to my wife?
A cause that could have initiated the TIA was a buildup of cholesterol, fatty deposits, which we call plaques, and they led to atherosclerosis in the arteries of her brain. The cholesterol deposits developed into a clot and stopped oxygenated blood from supplying her brain. This is why she displayed the symptoms of TIA. And with me today, I've brought this teaching tool. This is an occluded artery, so you can see the vessel inside has cholesterol deposits, which is signified here by the yellow parts, and the red is the blood. So when we flip this over, you can see that it takes the blood a lot longer to get through the vessel and reach her brain with the oxygen, which is exactly what happened in your wife's case.
So is the clot still in her arteries?
No, the clot was very little, so it dislodged and the oxygenated blood was able to reach her brain again and the symptoms subsided.
Oh, is there any way we can prevent that from happening again? It was a pretty scary experience if I do say so myself.
Yes, there are many risk factors. Ones you can't change are family history of TIA, being 55 years or older, previous health history of having a TIA increases the risk of it happening again, history of sickle cell anemia, high blood pressure, and diabetes.
What's considered high blood pressure for the elderly?
For the elderly, we strive to have 140 over 90 millimeters of mercury or lower.
Oh, thank you. I didn't know that.
Although there are quite a few factors that you can't change, you can prevent and control her high cholesterol levels by eating less saturated fats and lowering her homocysteine amino acids, using prescription medications, and control her weight so that her body mass index is less than 25 and her abdomen area is not larger than 35 inches in diameter. You can also apply some lifestyle choices like ceasing smoking if she currently smokes, increasing physical activity, providing good nutrition, keeping hydrated, and avoiding heavy drinking and using drugs.
Thank you, Magda. I understand all that except for that one thing you said about homocysteine amino acids. What is that?
Actually, I can get another nurse who has more knowledge on the subject to come and talk to you. Thank you for your time, Gary. I'll get her to come in.
Thank you, Magda. Nice meeting you.
Nice to meet you as well. See you later, Gary.
Bye-bye.
Good luck with your wife.
Come in.
Hello, Gary. My name is Asha, and I'm a student nurse. I heard you have some questions for me.
Yes. Magda mentioned that we can prevent homocysteine something.
She was talking about homocysteine amino acids.
Yes, that. What is it, and why is it important?
Homocysteine amino acids are part of what makes up protein. When proteins are broken down, there is an elevated amount of amino acid in the bloodstream and can lead to atherosclerosis, blood clots, heart attack, or stroke.
Okay. What is the homocysteine important for?
Cysteine is an important protein in the body. It's a source of sulfide. It metabolizes different metals in the body, including iron, zinc, copper, and acts as an antioxidant as well.
Well, what are the normal levels of homocysteine in your blood?
Optimal levels of homocysteine in the blood is between 10 and 12 micromoles per liter.
Are there any signs or symptoms of homocysteine levels to be too high?
There are no symptoms of high homocysteine in the blood, but if it builds up in the lining of your wife's vessels, then it can cause atherosclerosis that leads to TIAs and eventually strokes. There's a connection between homocysteine and the carotid arteries, which is the artery that brings blood to your brain. The higher levels of homocysteine, the more narrow the carotid arteries, which leads less blood flow into the brain. This is why it is important to keep these levels low.
What causes homocysteine levels to be high?
Well, dietary deficiency in vitamins B6, B12, and folic acid can cause this. And alcohol as well can independently cause homocysteine levels in the blood to rise, and it can also be hereditary.
And how would we be able to keep it lowered?
Well, you can take supplements for vitamin B6 and 12, as well as folic acid, and that can be monitored by blood tests.
That is fantastic information. Thank you for everything.
No problem, Gary. Now Lena will come and talk to you about stroke. Nice meeting you.
Nice to meet you.
Come in.
Hi Gary, my name's Elena. I'm a student nurse and I just want to help explain to you the difference between a TIA and a stroke. Do you remember what Nurse Magda said about TIAs?
Yes, I understood they are a sudden loss of function from a blockage of blood going to the brain.
Yeah, that's right. So TIAs and strokes are very similar. The main difference is that a TIA is temporary while a stroke is permanent and causes brain tissue death.
What causes the tissue death?
The loss of blood supply to the brain and oxygen causes tissue death. Depending on the location and how long the area is deprived of oxygen, it can lead to a range of physical, cognitive, perceptual, and sensory complications.
Can you give me examples of what could happen?
Of course. A person can have difficulty with movement and balance. They may experience emotional and behavioral changes along with memory problems.
Is my wife more at risk for having a stroke?
Yes, her age and a history of a TIA and her blood pressure increases her risk of having a stroke. Up to 17% of people who have had a TIA will have a stroke within 90 days, and her blood pressure was 150/90, which is above the normal range.
Oh, okay, now I understand.
Do you remember what warning signs Nurse Magda told you to watch for TIAs?
I remember her saying that some of the signs are sudden numbness or weakness of face, arm, or leg, sudden confusion, trouble speaking or understanding,
Yeah.
sudden trouble seeing, troubles walking, dizziness, loss of balance or coordination, and sudden severe headache.
That's right. The signs for a stroke are the same. Make sure you are very aware of them and call emergency services if they do occur. Do you feel confident remembering these warning signs in the future?
Yes, I think I know, but it would be nice to have it written down. This is all so new to me.
Yeah, no problem. I do have a pamphlet here with information on signs and symptoms of a stroke that you can refer to.
Oh, thank you. This pamphlet will be very useful for me.
Yeah, you're welcome, Gary. I hope it'll come in handy. It was very nice to meet you. Nurse Becca will come in and to talk to you about drugs your wife will be taking.
Okay, thank you. Nice meeting you as well.
Yeah, good luck with everything.
Thank you. Come in.
Hello, Gary. My name is Rebecca, and I'm a student nurse here. I'll be educating you on the different medications that your wife can take. Do you know what medication she's currently on?
No, I'm not sure. Something about blood pressure?
That sounds about right. Monitoring blood pressure when a person has experienced a TIA is important. I'm going to talk to you about a few different medications that are prescribed for a person in such a situation.
Okay, great. That will help me a lot.
All right. So typically people are prescribed, if not already on, an antihypertensive. This is to help lower high blood pressure. An example of a first-line antihypertensive is an ACE inhibitor called captopril. Excuse me.
What other medications were you talking about?
Well, there are two classes of drugs that can help prevent clotting, an anticoagulant and an antiplatelet, and they inhibit the action or formation of the clotting process.
What do you mean by clotting process? What is that?
Well, in regards to a TIA, a clot is the formation of platelets that can form an obstruction in the blood vessel. So what we want to be using is an anticoagulant, which will inhibit the formation of the clotting process. So an example of an anticoagulant is warfarin, which is used most frequently.
Okay, that makes sense. What about antiplatelets?
Okay, well, antiplatelets prevent platelet aggregation, which means it makes them less likely to stick together. And prevents clot formation so that blood can flow easier through the vessel. A low dose of aspirin is an example of an antiplatelet. Both of these medications, the antiplatelet one I told you about and the anticoagulant, both do have a risk for bleeding though.
Okay, does she need any medications for her cholesterol?
Well, yes. Well, typically, if the patient has high cholesterol, they're put on a class of lipid-lowering drugs called statins. HMG-CoA's reductase inhibitors is an example of a first-line therapy for hypercholesterolemia, which just means high cholesterol in the blood.
Okay, good. Is there anything else I need to know about the medications?
Well, yeah, just make sure that they're taken as directed and they shouldn't be stopped. So even if she says that she's starting to feel better, to keep taking the medication at the dose at the scheduled time.
Okay, are there any effects if these medications are taken with others?
Well, there are some interactions between medications that may cause confusion, memory loss, insomnia, nervousness, hallucinations. So make sure that you notify the doctor so that they can prescribe like a substitute medication or just adjust the dosage. And be aware that herbal medications and alcohol may cause like negative interactions between some of these meds.
Okay, thank you. That is a lot of help for me to understand her medication.
No problem, anytime. If you have any more questions, feel free to ask. Now Kasha will be coming in to tell you about exercise.
Thank you, Becca.
See you.
Hello, come in.
Hello, my name is Kasha and I'm a student nurse, and I'll talk to you about the importance of exercising.
Okay.
What kind of activities do you and your wife enjoy?
Well, we do go for Tai Chi class once a week.
Okay, that's a good form of exercise. However, let me tell you about a few others, since physical exercise is important on a daily basis. Walking, bending, and stretching are forms of exercise that can help strengthen your body and keep it flexible. Mild exercise, which should be undertaken every day, can take the form of a short walk or simple activity like sweeping the floor. You can even do some stretching exercises, such as extending the arms or bending the torso, while at home. Swimming is another beneficial exercise, if the pool is accessible and if you are able to accompany your wife. The exercise session should be scheduled for a time of a day when your wife and you feel alert and well. If the exercises are too tiring, divide them into 2 sessions, perhaps once in the morning and again in the afternoon. You should consult an occupational therapist and/or physical therapist who can help in selecting the specific exercises that will benefit you, and who will provide instruction for both you and your wife. We can connect you with these resources. I actually have them prepared for you.
Oh, great. This contact information will be really helpful, and your suggestions sound like something my wife and I can incorporate into our daily routines.
There might be no need to assist your wife in exercises, but you should be nearby during the exercise session. You can also offer physical assistance and encouragement when needed. Another important thing to remember is the risk of falls.
When my wife fell before, I didn't know what to do about it, so this will be very helpful.
In case your wife falls, before attempting to help her stand up, make sure she has not been injured. If there are any cuts, bruises, or painful areas, make her comfortable on the floor while you call for help. Do not attempt to move her until the help arrives.
All right, that sounds like a good plan. However, this is so much to take in all at once. I'm very stressed about her condition.
It's normal that you may become so preoccupied with caring for your loved one that you forget to take care of your own needs. As a caregiver, try to encourage as much independence as possible. Allow your loved one to make decisions. Support her participation in leisure activities and then try to find some fun activities for yourself. If you can give yourself a break from caregiving, you'll be helping both yourself and your loved one. Don't be shy about asking for help from your family, friends, neighbors, or community volunteers who may be able to give you a break for a few hours each week. Strive to create a rhythm to your daily life, a rhythm that respects the needs of everyone in your life, including yourself.
Thanks to you and your team of student nurses, I now know more about my wife's condition. The pamphlets are a great teaching tool for me, especially being an elder, to take home, and I really enjoyed the prop of the obstructed vessel. Asking me if I understand everything was a great way to evaluate my knowledge and attention on the subject matter. Thank you.